The goal of our special series, helping people make good decisions about their health and their future. Here's just some of what you'll see during our 4 days of coverage. We'll talk about resources that help seniors live healthier lives. You'll see the newest high-tech homes that help older Americans live independently. We'll introduce senior volunteers who keep themselves active by improving the lives of others. And we'll talk about planning ahead for your medical future. But first, living longer and better. Medical experts say there are 3 things senior citizens should do to keep themselves fit and healthy. What are those 3 things? OnQ's Tonya Caruso has the answer as we continue our special series, Age Well, Age Wise.
Up and then twice as long down. The number one way that people can take control of how they age is to exercise.
Dr. Vonda Wright is an orthopedic surgeon at the University of Pittsburgh Medical Center.
There's almost no part of our lives that is not positively affected by just 30 minutes a day of exercise. You know, lots of people say to me, aren't I too old to start? Or it's been 25 years since I did anything. The good news is that there is never a time when our body will not respond to exercise. And we can start slowly. We don't have to make huge goals like running 10 miles at a time.
But sedentary habits spanning multiple decades are often hard to break.
And many times I tell people to simply get off the couch and go take a walk. It doesn't have to be complicated. You just have to take your keys, walk out the door, walk around the block for 30 minutes. We try here at the Center for Sports Medicine to help people in this process with a program called START. It's part of our bigger umbrella group of programs for masters age people. It is a 12-week program where we literally take participants from the couch to a 5K race, which is 3.1 miles, in 12 weeks. We meet twice a week, and we teach them how to exercise, what's important about nutrition. And when we start in the summer, we end at the great race.
56-year-old Linda Kim of Erona enrolled in START and has run 4 5K races, including the Great Race. Hard to believe because just a few years earlier, she topped the scale at 215 pounds, and she's only 5'2".
And I was pre-diabetic. I was on high blood pressure medication. And I think the pre-diabetic part is what scared me into action. That and the fact that both my mother and my grandmother died before they were 65 of heart-related problems. My grandmother had diabetes. So it was past time to get moving, get fit.
Since 2007, Linda's lost about 50 pounds. But there's one other major side benefit to her weight loss. Her general health has also improved.
I no longer take the blood pressure medication. I'm no longer pre-diabetic. So, you know, the paperwork shows that I'm in a much better place than I was 2 years ago.
Everybody knows the common benefits of exercise. You will lose weight. Your heart can become stronger. But there are surprising benefits to exercise that people don't realize. For instance, our brains function better when we exercise. Sexual function is increased when we exercise. We get stronger, not only just our muscles, but our bones get stronger. There's almost nothing about our bodies that won't get stronger when we exercise.
Linda's serious about staying fit. She keeps track of her workouts with a spreadsheet and log.
Get started. Surround yourself with people that do the same things, because if you're back with friends that don't want to do things and don't want to move around, want to go to the show and eat popcorn all night, you're doomed. It is an endeavor, and it's a commitment, and you have to stick to it.
And sticking to it is the key. But first, get started.
My best advice for people who really want to live vitally until the last minute they're living is to invest 30 minutes a day in their exercise health. Step away from the table, head out the door, get out into the sunshine, and get your heart rates up. There are so many benefits, you just can't go wrong.
And again, Dr. Wright says you are never too old to exercise, but you should check with your doctor first, and that does include those in their 80s and 90s. As for the START program, the next 3-month session will begin in July at the UPMC Center for Sports Medicine. There's more information on the START program on our website at wqed.org/OnCue.